So I've been asked this question a few times about a natural form of preventing or treating UTIs. First and foremost, it is really important that you get yourself checked out if you are experiencing regular UTIs, just to rule out anything underlying that could be an issue. There is a product called D-mannose. This one here is by the Waterfall brand. It's available in pharmacies and health food stores. And what D-mannose does is it adheres to the bacteria that would be in the urinary tract. So bacteria such as E. coli. So it adheres to it, and then it means that it doesn't stick to the urinary tract and it is flushed out when you do a wee. So it reduces the risk of infection in that way. The D-mannose is actually a simple sugar or a monosaccharide, so it is closely related to glucose. There have been studies done and they prove that taking D-mannose regularly and consistently can reduce the incidence of UTIs in women. Now, you never hear me talking about women's bits without hearing me talk about Bactrim. This is the applicator. And inside the applicator is a little tablet this size, smaller than a Smartie, and it is estrogen. So if you put this up into your vagina, it can release the estrogen into your vagina to help plump up your vagina, help with vaginal dryness, help with discomfort, help with intercourse. But what it does also is it can travel through the vagina into the urethra, into the urinary tract, and it can help prevent UTIs as well that way, because women of perimenopausal and menopausal age, their reduced estrogen levels can also make them more prone to UTIs. So before you go on long-term antibiotics, it would be worthwhile trying something like the vaginal estrogen, or definitely trying the D-mannose and seeing if either of those would help. And there is also a form of hyaluronic acid which can be syringed into the bladder. It helps to restore the normal lining of the urinary tract, and it can be used to treat painful bladder syndrome, interstitial cystitis. And it can be administered at home by you yourself after you've been trained by a doctor or a nurse. So there are options for you out there, and it's really important that you know who to ask the questions from and to not suffer in silence if you are experiencing regular UTIs and you're in pain with it, it's affecting your quality of life. It is not a case of put up and shut up.